So soy controversy. When Rob and I were talking about this talk, he brought this up as something that some people might be interested in addressing. So soy has been demonized as being, cancer causing, and actually there's really no evidence to support that whole soy causes. So your organic tofu, edamame, soy milk, soy nuts, and then your fermented soy products, there is no evidence to support that it causes cancer. And in fact, the professor who taught our oncology section of the fellowship, his name is Don Abrams, he advocates intake of whole soy a couple times a week, even for people that have, breast cancer, prostate cancer, which are the ones that are most often mentioned. The one area that I would show caution, though, is in soy isolates. We really don't know about the safety of soy isolates, and they are very common in a lot of processed foods. So if you get like energy bars and things like that, start looking at the label. Very often they'll have soy isolates in there. Or people might add this to like an energy shake or something like that. I would just avoid it. And I think if somebody's going to go that route, is just to make sure that it's organic. Most soy that's produced is GMO, 85% of it, which means it's probably also accompanied by pesticides and herbicides as well.
I think we hear a lot of estrogens in our environment. People talk about, I think it's confusing. There's phytoestrogens, plant-based estrogens, and xenoestrogens, which maybe are more artificially based. And I think in the literature there's pros and cons of estrogens, and so there's thought to be some benefits of estrogens. So I think I read before that, hey, phytoestrogens are bad. When you look also on the flip side, there's some health benefits of phyto. So I think it's hard to draw that. But I think when you talk about more synthetic-based estrogens, xenoestrogens, I think we struggle more with that.
Yeah.
So again, if you tend to do more whole foods, even though there may be sources of some estrogens, I think again there's on mineral density, there's certainly benefits of estrogens in certain quantities.
Especially for somebody who is trying not to eat as much animal-based protein. It's such a great source of protein. It's a complete protein. So it would be a shame to eliminate that completely. And that may be the best option for some people, particularly if they're vegetarian. The other thing I want to mention is that there are phytoestrogens in other foods, and a lot of people aren't aware, even a lot of beans, as well as even things like broccoli. So for people, I just want to make a mention for people who have thyroid issues. There also are chondroitins, so soy and things like broccoli. You do have to be careful because they do affect the conversion of thyroid hormone into its active form. So just caution for people who have some thyroid issues. But otherwise, I would say once or twice a week is completely safe. So this is my favorite slide, I think. So insulin, the master hormone. So I hope people aren't disappointed that I'm not talking a lot about testosterone and estrogen. Obviously, it's very important, but I think insulin is the primary driver of a lot of the other hormones. So I want to talk about the concept of insulin resistance because it's going to prove to be super important, and we'll get into this further in the oncoming slides. So in a normal cell, insulin and glucose go together, and the insulin helps glucose get escorted across the cell membrane through the insulin receptors. And in an insulin-resistant cell, I kind of likened it to you got a fire, or you need to get into a home, and you're trying to break through a door, and you're trying to get in, but you're just meeting a lot of resistance for some reason. So then you have to recruit a bunch more guys and gals. That's the insulin to actually break the door down. So once you develop insulin resistance, and insulin resistance occurs for many reasons, which we'll talk about, your pancreas then has to work really hard then to make more insulin. And at some point, if the insulin resistance is too much and your pancreas can't make enough insulin, that's when people develop diabetes. That's a really simplified version of that. One of the most common causes is too much sugar and too many refined carbohydrates. And that's going to drive up the amount of glucose that's in the bloodstream and therefore the level of insulin that's in your body. So one of the most common causes of insulin resistance is diet, poor diet. The other thing that happens in this scenario, right, you don't see a lot of glucose molecules making it across that cell membrane because of insulin resistance. This produces a stress response because your cells are starved. So that produces a stress response, including cortisol, which then dumps more glucose into your bloodstream. So it becomes just a vicious cycle. I'm going to introduce the concept of glycemic index, like glycemic load, because it's something that I think people are hearing a lot about. And in short, it's basically how quickly does a particular carbohydrate cause your glucose level to rise? How quickly does that carbohydrate cause you to dump glucose into your bloodstream? So the higher the glycemic index, glycemic load, the higher the spike of your blood glucose. The lower the glycemic load, you're going to get a gradual increase of your glucose in your bloodstream. Does that make sense? Okay. And why is this important? So high glycemic index load carbs cause spikes in your blood sugar, which causes spikes in your insulin level, which causes inflammation. The other thing it's associated with as well, so insulin promotes cell division and growth, and this is linked to cancer. So inflammation and cancer. So you can see why what you eat has a huge impact on your body. This is basically most of our chronic diseases right here, those two together. So this looks like a busy slide, I'm sorry about that, but it was really hard to put this all together. So insulin resistance, we've defined what that is. And the ones that are in red there, well, these are ones that are involved in a vicious cycle. So if your hormone balance, if you have hormone imbalance, it actually can cause insulin resistance. But insulin resistance in of itself can also cause hormone imbalance. This becomes a vicious cycle. Same thing with being overweight, obese. This causes insulin resistance, but it actually causes you to become more obese. Inflammation causes insulin resistance, which causes further inflammation. Poor sleep, we'll talk about sleep in some later slide, causes insulin resistance, which then can cause problems with sleep and lead to things like sleep apnea. And then, of course, we've already talked about excessive sugar and refined carbohydrates, and the high fructose corn syrup is in there as well. So what are the other factors that can cause insulin resistance? So age and genetics, we've talked about that. We're going to talk about stress, inactivity. Tobacco we're not going to talk about much, I'm just going to list it there. Alcohol we'll talk about, certain medications as well. But what does this all ultimately lead to? All of our inflammatory disorders. These are all that chronic long list of medical problems that I talked about at the beginning. This is where it leads. Diabetes, hypertension, lipid issues, kidney disease, cancer, increased clotting, endothelial dysfunction, and in women, PCOS. And then the big one, diabetes and cardiovascular disease.
So this is also, I think, when I think about that case talked about, which I see so frequently, mid-40s, right, tired, fatigued, mental health issues, struggling with libido. I think of the cartoon example, like as humans, right, we were designed to hunt, right? We had lots of stores, and we were designed to be able to have periods of starvation and be able to maintain this homeostasis, be able to keep our blood sugars in a close range, our electrolytes in a close range. I think in our Western medicine, we've done a good job, at least in our day-to-day, we've done a good job kind of screwing that up as you talk about endocrine disruptors. It's a classic example I think of, and this is what I think about what happens over years and really decades, is when I see that 45-year-old who's exhausted, I think we've taken, so you take somebody who's stressed at night, right, they wake up in the morning, they've had a crappy 5-hour night's sleep, which is not uncommon, right, environmentally, you guys know that, right, so you wake up and what we know about sleep's critical for healthy hormones, right, so if you're not getting good sleep, your brainstem's not working up, if you're not getting a deep sleep, you're not releasing luteinizing hormone, right, luteinizing hormone is talking to our Leydig cells and our testes and make testosterone, so if you're not sleeping well, you're not getting that natural testosterone, you're also not getting the natural growth hormone release. So then you wake up in the morning, you're tired, so then you're like, I'm going to go to comfort food, right? So you're not going to eat well. So then you're going to go to some carb-laden meal. So you're going to get this big spike of your glucose, and what follows it, insulin's going to spike. And so then you get the inflammatory response, but then your body stores it, right? It's glycogen, but it's storing it because I'm going to go hunt, right? I'm going to go hunt, I'm going to go work out, I'm going to do something. But now you've had this big, heavy meal, and now you're right, you're hypoglycemic, you're hypoglycemic, you're tired, and you're a little fatigued, and you're like, you know what, I don't feel very well, I'm going to skip my workout today. So now that stores that it's supposed to be using, right now it starts to get converted into adipose tissue, which we know adipose tissue is going to further convert aromatized testosterone into estrogen. So we're creating this vicious cycle. We also didn't get that workout in, so we didn't get that natural sympathetic release, right? So when we work out, it drops our sympathetic tone, we feel better, right? Blood pressures drop, we release healthy hormones, serotonin, norepinephrine, dopamine. So you don't get that. So then your day goes on, right? We all have stressful jobs, right? So that stress becomes unaccommodate, right? It's overwhelming to us because you didn't get a workout and you didn't eat well, and now that's stress. And so cortisol levels continue to go up, which further impacts insulin and our inflammatory levels. And then finally you get to the evening, right? So we stress day, I'm going to have something to drink, we're going to have some alcohol, and you have a late meal before I go to bed, and that late meal is going to spike your insulin, and insulin's going to partly disrupt again your ability to release your healthy hormones. So it doesn't happen overnight, it doesn't happen in weeks and months, it happens over years, and so this is all part of that.
The beauty of it is that when you look at it this way, you can actually identify pretty quickly where you could impact your health. And I think that's the benefit. Because I think that's a mouthful, that's overwhelming. But if you can take one of these things, like one at a time.
This happens to all of us.
Yep. Oh,
Yeah.
very guilty of it. So anyway, and in the future slides, we'll be talking about all these issues that you've just discussed. So.
While you're doing that, the other huge disruptor I see all the time, and I always have to look at, and I didn't appreciate this my first 5 to 10 years in medicine, is the impact of sleep apnea, right? So again, you take somebody who, hey, I snore a little bit, but I don't think I'm struck at night. Well, then you do a study, you find out they dip their sats at night. So, where you're dealing somewhere in the 90s, all of a sudden you find out they're in the 80s, maybe even low 70s. So as you do this periodic breathing all night long, as you just start to get into stage 3, 4 REM sleep, you drop, start choking, you wake up. So you never get into that deep, restful, restorative sleep, so you don't get that luteinizing hormone release. So the first thing I ask is, let's figure out what you sleep. Do you have sleep apnea? So before we talk about doing hormones, let's correct that first. It's amazing how much better people feel. And they start to get healthy hormone release again, and they sleep better. And it's one of the most classic disruptors I see.
But I think what typically happens with a lot of patients who don't have your level of care is they come and they tell the doctor they have a sleep problem, and the next thing they get is a sleep aid, which actually further worsens their sleep apnea. So that's what I see a lot of. And they never feel very good. So now they're on a medicine that they've become dependent on, and they still don't sleep very well. So,
Yeah.
So this is about overweight, obesity. So a couple things are going on here. You talked about aromatase. So aromatase is actually a hormone that's in our ovaries and testes. It's not unique to fat, but it is present in a large amount in fat. So testosterone gets converted by aromatase into estrogen. So if you are overweight, obese, you are going to be converting a lot of your good testosterone to estrogen. I put there estrogen factory. But a couple of other things are taking place as well. We've already talked about fat promoting insulin resistance, but fat also produces something called leptin, which is another hormone. Leptin, in an appropriate amount in your bloodstream, suppresses your appetite. It's a satiety hormone. When you make too much leptin, it's a little bit like insulin, how you have too much insulin around and you get insulin resistant. Well, the same thing happens with leptin. You become leptin resistant. So now something that's supposed to help tell your body, I'm not hungry anymore, I'm satiated, is no longer working. So your whole hormone system is completely out of whack. So you could see how this, again, becomes a vicious cycle. And then also fat promotes inflammation. It makes its own inflammatory cytokines, which we've already figured out that inflammation causes insulin resistance, which causes more inflammation, which causes hormone imbalance, right? Another vicious cycle. And then you alluded to this, which is whether it's testosterone or estrogen, you're sending a signal to your brain, up to your hypothalamus, that says, I don't need any more hormones, so it decreases your luteinizing hormone and tells your testicles it doesn't need to make any more testosterone. Again, another vicious cycle. Now I put the beer bottle there just as to remind me to talk about alcohol, because this is a big one. for a lot of people, because it's kind of, people, like you said, they get stressed, they feel like they deserve that glass of wine every night, maybe two, maybe more than that, just to unwind. But if people are really struggling with the issues that were described with hormone imbalance or with their weight, that's probably the first place you need to look. So alcohol does two things, well, does more than that, but it makes you overweight. So then, of course, it drives the cycle. But alcohol also is aromatase promoting as well, independent of being overweight. So it's really a double whammy. Actually, I would encourage people, if they think that, maybe I do have a glass of wine every night, just to do a challenge. Right. I did this too, because I was used to having a glass of wine with dinner most nights. And a friend of mine who really enjoyed her wine gave it up for 30 days, which turned into 60, turned into 90, and basically 6 months. And she said, Aim, I am sleeping so much better. It's so much easier to maintain my weight. I have so much more energy. And so she went back to maybe every once in a while on a special occasion. So she inspired me, so I went ahead and did that. And yeah, it's pretty amazing how much better you sleep. So if somebody doesn't really want to give it up, you just want to experiment, see how it makes you feel, I would encourage you to do it for maybe 2 to 4 weeks and see how it makes you feel. You don't have to give it up forever.
Alcohol works at the GABA receptor, right? The GABA receptor in the brain is a chloride channel that promotes sleep. So when we drink alcohol, right, we get sleepy, but the problem is several hours later, you get withdrawal of that receptor. That's why people classically, especially when they drink it, they wake up at 2, 3 in the morning, I can't sleep, right? And if you can, that's the genetic, maybe different if you have one drink, but especially if you have several drinks, it really squeeze out that
Even
GABA
one
receptor.
drink.
Even one drink.
Last night I decided to have a glass of wine. I was up at 2 o'clock in the morning.
Is that right?
Yeah, because I don't have a glass every night.
Now you're unsensitive.
So I got up and I made myself some sleepy time tea with valerian root. It was great. And I went back to sleep. It had nothing to do with the fact that I was giving this talk today. Okay. So I hope you don't get stressed out looking at this, because it's kind of stressful looking. But anyway, this is the hormone pathway, and I think it's really important to have this as an illustration so you can understand how your stress hormones actually impact testosterone and your progesterone estrogen balance. So first I want to point to cholesterol, which is the backbone of these steroid hormones. So these are all steroid hormones. Because cholesterol is demonized, right? We all think cholesterol is bad. But cholesterol is really important. It is the backbone for all of these really important hormones. It's also a backbone for vitamin D, which is also very important. So you don't want to drive your cholesterol level down to nothing, right? We need this in our body.
It's our LDL cholesterol. That's the driver.
So you have two competing pathways here, right? So pregnenolone is I guess the mother hormone, right? And it goes down two pathways. So it can either go in the direction of our stress hormones, cortisol and aldosterone, or down via DHEA to testosterone, which then gets converted to estradiol via aromatase. So you could see if somebody had chronic stress, what's going to happen? It's going to drive this piece of the equation in this direction, and you're going to get a lot less of testosterone. You're also going to get a lot less of progesterone because it's all getting converted into cortisol and aldosterone. That balance in women is very important, so you're going to end up having things like irregular menses and that sort of thing. And in men, you're going to have a low testosterone level. I like this slide. I took this from a video about the LA Fire Department, and I just did a quick shot of this. In one segment, emergency personnel may witness more trauma, loss, death, and destruction than the average citizen would see in a lifetime. So fire and police are 2 and 5 in terms of the most stressful professions behind, I think, with military as well as air traffic controllers and pilots. But I put in here, stress is not the situation, right? Stress, real or imagined, is really how we interpret that stress or how we deal with that situation. And there's good stress, right? If you feel, sometimes it can make you more alert and more focused. I know in the emergency department, if I have a sick patient, those stress hormones are good. They help me take care of that patient. If you guys are in an emergency situation, those stress hormones are going to be helpful. And when are they bad? It's bad when the demands of that stress really are much greater than our ability to cope. We know that we see people all the time, two people with the same exact stress, and some people can deal with it well and with grace, and other people can't deal with the smallest amount of stress. And a lot of this has to do with our foundation, right? Our education, our preparedness. Are we an optimist at heart? That has a huge impact. Things like just challenge versus threat. Is what I'm perceiving right now, is this a challenge? And the social support. So I'll use, just even preparing for this talk today, and I look at those elements, I say, okay, if I prepare enough, right, if I know what I'm doing before I go in, then I'm not going to be as stressed. So there's my starting point. I'm pretty optimistic that it's going to go okay, right? And then challenge versus threat. I perceive this as a challenge. This is something I enjoy. Is it stressful? Yes, but I perceive it as a challenge, and I'm excited about it. And social support, getting the support of my partner who's sending me texts saying, hey, good luck today, all these things, and Rob, all these things are factor in. So this is all good stress for me. But stress can be bad, acutely or chronically. If the sirens are on all the time, right, this is going to affect us in a deleterious way and can lead to a lot of stress-related disorders.
So what happens with acute stress? So that's the classic fight or flight reaction. That's a neurohormonal response. So that includes our hormones, cortisol and aldosterone, which we talked about in an earlier slide, as well as adrenaline. And these are the physiologic changes that take place. We know these because we've all experienced them before. Our heart rate goes up, blood pressure, our respiratory rate goes up, stress response, increased glucose, right? Which is accompanied by increased insulin, but also increases our cholesterol, causes vasoconstriction and increased clotting. You could see how in the setting of, let's say you're a trauma victim, how all of those actually would be helpful, because increased cholesterol is going to drive for more stress hormones. This is going to provide us with the stress hormones that we need. Vasoconstriction, probably going to prevent us from dying, or at least try to, right? And increased clotting, prevent us from bleeding out. But what do those all look like? They look like all those chronic medical issues, right? We've got high blood pressure, insulin resistance and diabetes, and increased cholesterol. And we also see these, if somebody's got an acute stress response, right, that's your heart attack or your acute stroke. And that's in the acute setting. And then the chronic stress response, these are the things that you were kind of mentioning. So that you feel foggy, mentally, people, they have memory issues, they don't feel great, they have mood disorders, anxiety, depression. Your immune system can be under or overstimulated. So people get sick often because they're stressed. But then this could include people who have issues like autoimmune issues. So it can be under or overstimulated. Sleep issues and weight gain, headaches, super common in the emergency department to see people with migraines triggered by stress. IBS is a classic one that's related to stress. And then, of course, leading to hormone imbalance, including low testosterone and irregular menses, and then bone and muscle loss as well. So acute stress response, this is part of our sympathetic nervous system. Our sympathetic nervous system, which is part of our autonomic or automatic nervous system. This needs to be balanced with our parasympathetic nervous system, our rest and digest mode. And so we need the stress response, but we also need to balance it with our rest and digest mode, or the parasympathetic nervous system. So this slide, the background on this also came from this great video from the LA Fire Department. They have a significant program to help them with stress that includes yoga. So this was a shot from that as well. So how do we begin to buffer stress? Going back to what Rob said, you have to start with the basics. Healthy diet, exercise, and sleep. And so I think as long as you're mindful, if you're stressed and you know that these are the three core things that you need to take care of,
you're going to push yourself a little bit harder to eat better. When you have an option of 2 different foods, you're going to think, well, I know this is going to affect how I feel. I'm going to make a better choice. When you know you have an option to sleep a little bit more, saying, you know what, this is going to actually make me feel better. And I do this now because I feel like the minute I'm up, I'm up. But now if I know this is going to impact the way I feel, I'm going to feel like crap going into work, I make myself go back and get that extra hour of sleep if I can. And then getting and exercising, really pushing yourself, even if it means getting outside, especially outside, if it's warm enough, to get some sunlight. For even if it's 10 or 15 minutes, it is so much better than doing nothing. And I strongly encourage people to pay attention to those 3. The rest of them, I consider this kind of like a soup bowl. And then these other things are all the ingredients. And it's not a one-size-fits-all. I think everybody has to decide for themselves what helps them achieve balance and grounding in their life. For me, I'd say probably spiritual connection, but not in a religious sense at all. It's just, I force myself to connect with those things that are important to me. And it's going to be work. And I really focus on, compassion with my patient. These are important. And that kind of fills up my cup in my daughter and my partner and my friends. And this, to me, is grounding and helps buffer stress. But there's some cool stats out there. I love these. So power of love. So one study looked at just the power of love and lack of social contact. Those individuals had a 3.1 times higher rate of death. People who are kind of angry people, 230% increase of premature death. Forgiveness Project at Stanford, this is interesting, they demonstrated that those people that learned to forgive had decreased blood pressure, muscle tension, were sick less often, had fewer chronic diseases. There is a huge body of research on looking at these individually and how it affects health outcomes. And then I'll mention mind-body techniques. I said meditate, not medicate. This is another one. Let's not suppress, let's figure out the underlying cause, because those medications are not good for us and are usually highly addictive. So lots of great research there as well, and I'll just look at, just breath work and meditation alone has been demonstrated to show improvements of stress level, anxiety, depression, pain perception, and just general quality of life. But there's a huge body of literature on meditation and yoga as well. So exercise. So this is interesting because I hear all the time that exercise increases your testosterone levels. And in fact, I really found it hard to find any studies that were long-term studies looking at sustained testosterone levels as a result of exercise. They're probably very hard to do. But I would say if it's testosterone you're worried about, I would say using exercise as a means to maintain your weight or to lose weight is probably the way in which it's helping you the most. We know that it helps with stress reduction, it helps with sleep, do it early in the morning, energy, and just a general sense of well-being. One thing I'd like to emphasize as well is just avoiding overtraining, because overtraining is stressful on the body. So that could undermine what you're actually trying to accomplish. And then I mentioned sex because I don't know why in medicine we don't talk about sex very much. So I don't know if you can, I actually looked to see if I can find an app that you could actually put that in, like an exercise app, and I think, I thought that would be great. But anyway.
Worried about overtraining? It has to be a quick timer.
That's awesome.
I can see that.
I think it's great. I think mixing it up too is great, makes it more interesting. And then I really encourage people to do yoga. I didn't do any form of yoga until I did the fellowship, and we learned all different types of yoga and Tai Chi. It was really quite an experience. And I try to incorporate that at least once a week, if not twice a week, if I can, into my practice. I find the breath work, stretching, and just strength training is it's it's really centering. So I encourage people to give it a try. And the other thing about yoga too, a lot of people think you have to be very flexible. I will tell you I'm not flexible. And I'm so grateful. I always have the person next to me who's like crazy flexible. And I am not that person. So anybody can do it. And you can do even seated yoga too as well if somebody has significant disability issues. Lack of sleep or poor sleep. So some people don't make sleep a priority. And a lot of people, a lot of my patients have insomnia issues. Very common in people that have like mental health issues, like some anxiety or depression, people who have pain issues as well. And then I'm going to plug in for alcohol. Again, I cannot emphasize enough how often I think alcohol is an issue. And you bring it up to people and they're like, yeah, but I don't drink that much. But they're really concerned about their sleep. And so now they're drinking and also taking Ambien, which is a bad combination. So if sleep is an issue, then I would highly recommend just giving a trial without alcohol. So what happens, like Rob said, you get fatigued. You're tired. I don't want to, I don't want to work out today. And then we go for our carbs because they're comfort food, just like you said. And this leads to an array of issues. We already talked about inflammation, but affects all the hormones, sex hormone, thyroid, leads to weight gain, sleep apnea. And sleep is really one of my favorite topics to talk about. I thought it was going to be a very sleepy topic when we were doing it in the fellowship, and it really was one of the most fascinating ones. So this is one, I'll spend time with my patients talking about this. So these are just a few ideas, but I would say starting in the sequence in the morning. So, it's very challenging for a lot of us that do what you do, and in my situation, to have a set schedule. Sometimes you just have no control over that. But if you do, and you can set a time that you go to bed and wake up in the morning, that's ideal. But obviously that's not a reality for most of us. I do encourage people to, exercise early on in the day because exercise can actually be very stimulating. So try to avoid that at night if possible. Try to get out and get some sunlight early. What we want to do is suppress our melatonin during the day, right? And then we want our melatonin, our natural melatonin in our body to be high at night. But most people, it's flipped. They don't get enough sunlight during the day. And then at nighttime, they're sitting there on their iPad or their iPhone or their computer with their blue light and suppressing melatonin. So most people's melatonin is completely opposite of the way it should be. So try to get some sunlight early on in the day as well. And then other issues during the day, I would recommend moving forward, as far as meals, try not to eat very late at night. Try not to eat a heavy meal close to bedtime. If you are going to drink early, not a lot, and with food, because you're a lot less likely to have that issue where you're waking up at 2 o'clock in the morning. I'm just going to mention a couple things. Medications. There are several medications in the big classes, like some of the antidepressant medications and a lot of the antihypertensive medications, which can have a side effect where they disrupt your sleep architecture. So if somebody has an issue, it's just important to look at the medications that you're taking. And then in my fellowship, basically the recommendation is that you don't recommend sleep aids on a regular basis. Sleep aids, like even Benadryl or Ambien, really disrupt your sleep architecture. And I'm going to quote him exactly. He said, "What Ambien does is give you amnesia to bad sleep." And lastly, just a plug for people with really severe insomnia, cognitive behavioral therapy, either with a therapist or through an online program. There's actually a mention of that online program in the resources that I gave out. Is really got a lot of good evidence base for it. So if somebody's really struggled, has tried everything, I'd recommend cognitive behavioral therapy. Okay, so we are almost at food. I think we're exactly at the hour mark. And I'm just going to introduce this slide, and then when we come back from getting some food, then we'll talk in detail about the individual kind of macronutrients, and if we have some time, micronutrients and maybe some supplements as well. So there is no evidence-based diet program for hormone balancing. There are books out there, like Sarah Godfrey has a book, How to Balance Your Hormones. I couldn't even get through the book, it's so complicated. And it's really not evidence-based. So I recommend an anti-inflammatory diet because it's just a prudent diet, and I'll explain why. So it's plant-based, whole food-based, and it mirrors the Mediterranean diet and Asian diets that have a very similar dietary pattern to the Mediterranean diet. And so what do we know about the Mediterranean diet? It probably has the most evidence-based of any diet that's out there. So we know that it decreases inflammation. We know that it has good primary as well as secondary outcomes for cardiovascular disease. And when I say secondary outcomes, that means people have already had a heart attack and how they fare on a Mediterranean diet compared to those that don't. Cancer outcomes, and the other ones include all of the cardio-obesity, so obesity, diabetes, hypertension, and lipid profile. So there is a fair amount of evidence for all of those, which is the reason why I promote the anti-inflammatory diet. And when you come back from getting food, we will talk about the anti-inflammatory pyramid, and we'll look at it in detail and go through that together. So Adam is kind enough to plate all the food, so feel free to go back and grab a plate.
I first want to thank Adam for.
He's awesome.
So Adam works with Amy in the emergency room. He's been a chef his whole life, and so he's come here tonight to help us prepare. And so,
Yep.
Thanks, Adam.